delegates, college, and participants. Um, it's my pleasure today to share our current work on implementation science in Vietnam. And before that, I would like to introduce myself again. My name is Thi Anh Thư. I'm currently the Dean of the Public Health Faculty in Hue University of Medicine and Pharmacy. Actually, this presentation made by our colleagues from Hanoi Medical University, who actually the people conduct the visa project in Vietnam with the collaboration with University of North Carolina in the USA. However, due to some urgent situation, our colleagues cannot join with me, so I will be present this on behalf of my colleagues. So some of the information that I cannot have the insight into the project itself, but I will try my best. But I also would like to say thank you for the organization to give us the opportunity to participate in the very, I think, informative and insightful of implementation science. We just give you some introduction about the project named Vietnamese Implementation Science Advancement, the name of the visa for short. And it seems that our work relating to implementation science is it's shorter than other in the world as well as in Malaysia. And we got the funding from the G45 HIV training grant from the US NHS from 2021. And we aim to end this project in 2026. And the visa program will build implementation science research capacity and apply implementation skills among university faculty researchers, health policy makers, and health program leaders to ensure evidence-based interventions are effectively translated and scaled up into routine practice in Vietnam. So we have three specific aims. First of all, we initiate the Hanoi Medical University implementation science program. Yeah. And the second, we will develop the implementation science knowledge and research capacity among faculty researchers at four health science university in Vietnam. And that's our four reputation medical university, including Hue University in the center, Ho Chi Minh City, University of Medicine and Pharmacy, including Hanoi, and also another university in medicine in Hai Phong, also in the north side of Vietnam. And for the entry, we developed the implementation science capacity among Vietnamese policy makers and health program leaders to foster translation of HIV research into practice. And you can see here the depth and diffusion model of the visa training program. So from the University of North Carolina, we will train the trainer from University of Hanoi Medical University through the global IS course, ongoing IS research, co-design, and also provide the PhD coursework and dissertation. And a couple of our professors from Hanoi Medical University attend this, and from this we also create the program for implementation research. After that, this implementation science program, we train it again to another four faculty trainees in Hanoi Medical University, Ho Chi Minh City University of Medicine and Pharmacy, Hai Phong University of Medicine and Pharmacy as well, where I'm based on. Include our project, we call it cohort 2, is also have policy maker and program leader also join in the cohort 2. And we train in short course, pilot grant. We also sit in the webinar, involved in many different aspect relating to implementation research and its related issue, and we aim to develop the course related to implementation research. So for the fellows training, the training completion, including visa faculty and policy program fellow, will have a solid foundation of implementation science. After this, I will use it IS for short. A common language for IS communication, and the established network of professionals responsible for HIV-related program design, implementation, and evaluation. For visa faculty fellow, we have developed at least one IS module or course of their home institution, targeted to bachelor degree, master, as well as the PhD degree for preventive medicine channel. So we also, for the strand of bring researcher and policymaker program leader together implementation research. So in each group in every region, for example, in Hue, we have 3 trainees at the moment, including me, one of my staff, and also a policy maker, people involved in our group in Hue. And the strength of being in that, because the action of communication between researcher and policy maker or program leader is a key barrier to effective translation of research findings into effective policy and routine practice. This is the first IS training program in Vietnam to bring together researcher, policymaker, and program leader. I should say that as far as I know, at the moment, still have different medical university or for example, University of Public Health. They have their own project like this for IS course. But Hanoi, the cohort from Hanoi University, Medical University, is the oldest one, and also relating to 3 or 4 reputable medical university in our country, as well as in the program they integrate the researcher and policy maker in each group. I think it's very good. And the joint training of faculty, researcher, and policy maker leader offer an opportunity to share expertise as well as perspective. So there are some training activity and course content, and you can see here with the 5-year project, they have different aim for the faculty fellows as well as the policy program fellows. And focus on the monthly club visiting, and also have a short call for evidence-based intervention for HIV, about the IS, also SIV. The trainee will sit in the webinar, in the course, in-person courses, as well as webinar 1. And later, it's also related to the curriculum developed, relating to IS in the future. And that's the ASPER, and that's the name of different webinar or course the trainees must be sitting during the program. And that's the timeline we get so far for the visa D43 in Vietnam. And it's aimed that in 2026 we will have both cohorts. We will sit into the advanced implementation science course. More detail related to the training, the content, the activity, people in charge during timing, and also the measurement. So far, in Hanoi Medical University, they also about to open the course as implementation science, apply implementation science in global health, and implementation science in global health for English and Vietnamese teaching for different kind of postgraduate students. For example, master in epidemiology, also postdoc, Also specialized level 1 is for practical, working in the hospital. And also the International Master of Public Health student. So that is the visa program so far. But coming here today, I would like also to share actually work of implementation science at our university. So you know that we also kind of familiar with the term of implementation science after Hanoi Medical University as well. So from last year, we familiar with that, and we start some of our work, and we should say that it's on the preliminary work. So we also involved in the research for scale, strategy for implementation, global consent to prevent sexual violence in university male students, and it is to start last year to 2028. Another hospital-based implementing science research is called VHS Plus, randomized control trial of the Cell Health Plus stress management program to breast and gynecological center cancer patients in Vietnam, and it's about to do it this year and next year. And actually, under the umbrella of the visa D43 in Vietnam, our team, we do the pilot research to inform adaptation of Project YES, an evidence-based intervention for HIV/AIDS patients aged 16 to 24 in Thừa Thiên Huế province, Vietnam, where our team based. So for the first two research, I just give the very brief introduction. So for scale, the strategy for implementation global consent to prevent sexual violence in university male students, actually we involved in the stage two of this project. The whole project is aimed to design the understanding how a program called global consent can best be implemented to promote healthy and respectful sexual behavior and attitude at universities across Vietnam. And as the evidence-based intervention, global consent is an online program that uses evidence-based content and proven to be change the behavior and harmful social norms. Program content figures experts in public health, social service, web design, and marketing. And for the first stage, it's already complete a randomized control trial with almost 800 male students in Vietnam into university, and it shows significant improvement in the behavior and attitude. So we joined this time, and we try to approach more than 2,000 lecturers and 3,000 male students at 5 universities. And they will have the chance to share their knowledge and perspective, and their participation involved in the web-based survey as well as receiving the educational material and attending educational webinars. So that's the very brief information about this project. The second relating to the Cell Health Plus in Vietnam, and you can see that this is the randomized control trial of the Cell Health Plus. That is actually the manual. Have the manual of the WHO to manage the stress among the people suffer some bad in the world in their life. And at the moment, we try to do it for the breast and gynecology cancer patient in Vietnam, and it's conducting within 8 hospitals along Vietnam. So for the pilot research to inform the adaptation of the project, yes, for the HIV patient in the young age in center of Vietnam, and there are 2 people in the research team, and because this is our project, so we know a lot more about this project. So the situation is the new case of HIV infection, many of them are in the young age. And we also face some difficulty at the CDC of the province where we live for treat well for this group of people. And through the guidance of the course, we found that the project, yes, is the evidence-based intervention, and this is the clinic-based and involvement of many different stakeholders related to the peer mentor, the healthcare staff, and also the caregiver themselves. So it's significantly proven to improve the adherence of ARV and decrease the internalized HIV stigma, as well as improve the viral suppression. So we try to use that, apply the new methods. And the specific aim for this research to assess the needs related to the HIV-related healthcare for the HIV/AIDS patient at this age living in Thừa Thiên Huế province. And M2 is to explore the facilitator and barrier to implement the project, yes, on this objective. So we select the location to do the intervention, and this pilot research, that is the Department of HIV, AIDS Control and Prevention in Thừa Thiên Huế province, and this is some number of the staff, the patient, as well as the OPC relating to this. So you can see that very limited human resource. And for achieving the aim 1 to assess the needs related to the HIV-related healthcare of HIV/AIDS patient in the region, we use the focus group discussion, in-depth interview, as well as scope review to contribute to this. And for the M2, we will use the focus group discussion and also the recommendation from the expert. So from this, we will explore the facilitator as well as the barrier. And after this, we will have the recommendation to modify the project, yes, that better adaptation in Thừa Thiên Huế province. And that is the component, the core component, as well as other components related to project, yes. And we hope that it will help in our situation. And also we prepare the timeline for this research. And at the moment, we just kind of get approved from the RRB, from the university, and very soon we will directly involve in data collection and conduct our pilot research. So that is all about the work, but because this is the first time I've been in Malaysia and attending this, I also want some share with you some information relating to the ourselves, the university, so that you will know us, and we welcome on the collaboration and also experience sharing related to implementation science in the future. So our medical university founded in 1957, and at the moment we catch up more than 10,000 students per year. The second line is relating to the public health. We just very new, founded from 2005. Currently we have 36 staff, but 2/3 of us training from overseas, so we have ability to catch up with the English and also the knowledge. At the moment we have 10 programs. I will introduce later, and related to 6 departments of public health, related to nutrition, environmental, occupational health, epidemiology, and the health statistics sector. And for the whole university, we have total 11 undergraduate programs, more than 100 postgraduate programs, and 3 joint international programs. And for public health faculty, with 36 faculty, we provide a program on Bachelor of Public Health, Doctor of Preventive Medicine, and Bachelor of Nutrition Science. And for postgraduate program, we have PhD level, master level, as well as practical certificate. And I show this because that most of our postgraduate program students are from the specialized level 2 in health management, where we really test the leadership in healthcare system for the health department as well as in hospital. And we willing to share with them about new knowledge and very practical related to implementation science. In our university, we also have the for a 700 bed hospital, so that we also have a practice science and all the hospital relating to the area. So it's a good point for practice as well. And we have our the journal, and it's quite reputable in Vietnam. And our university also have very strong in international collaboration. And if you want to contact later, please share with me through the email and the phone number. And lastly, I would like to invite you to visit Vietnam in some time. You can see the beautiful picture from the north, the center, and the south. Some of them familiar with the views in the north or the south in Ho Chi Minh City and Hanoi, but please come to Hue City, also beautiful as well, and we warmly welcome all of you. Thank you very much for listening.
Thank you very much, Dr. Tang. The floor is now open.